Hello, friends, and welcome to Weekly Witness, Texas Impact's weekly podcast designed to help mainstream Texans of faith understand the legislative process and help you engage with public policy in the great state of Texas. My name is Scott Atnip, your host and Texas Impact's Director of Public Witness, and this will be our last episode before the new year. I know, cue the sad music. So on behalf of the entire Texas Impact team, we hope you have a meaningful holiday season and that you're able to connect with friends and family and loved ones and find some joy and peace. I know in the episodes after the election, I said on this program that I hoped everyone would spend some time touching some grass and centering yourselves. And I hope that even more for you in the next week or two, except for the time you're going to spend doing the homework Diana asks of you over the next few weeks. But when we come back, Congress will have convened, the Texas Legislature will be preparing to come to town, so I hope everyone comes back from the holiday ready to get to work. And I mentioned Diana. Last week, Diana Forrester and her colleague Alec Mendoza joined the program to talk about health policy in Texas. And this is such a big topic, and so much of it is driven by federal policy that we're joined again this week by Diana to continue the conversation about how actions by Congress could impact health here in Texas and how you can help protect Texans' access to health care in the coming weeks. As always, Texas Impact has tools for you to stay up to date on what's happening and to get involved in effective advocacy. We have our rapid response team and our issue champions, and we plan on bringing back the weekly Inside Baseball Zoom check-ins. Learn more about all of the opportunities to get involved at texasimpact.org, click on the Action Center, or shoot me an email at scott@texasimpact.org. And now's a perfect time to give because Giving Tuesday kicked off Texas Impact's annual membership drive. Member support helps us create programming and respond to public policy opportunities and threats. Your membership commitment strengthens our network and demonstrates your values as a faithful Texan. It's clear there are significant challenges coming in the legislative session, as well as important opportunities to strengthen the ways we keep Texas kids healthy, keep families thriving during tough times, and keep the lights on over all of our state. If you're not a member of Texas Impact, I ask you to consider joining us today. Your membership allows us to equip and mobilize Texans of faith in their communities and at the Capitol. There will be a lot of work to do, and we look forward to partnering with you throughout the legislative session. But between now and then, we hope you have a wonderful and meaningful holiday season, and we look forward to seeing you again in the new year. But for now, I hope you enjoyed today's conversation with Diana Forrester. Joining us again for today's conversation is Diana Forrester, Director of Health Policy for Texans Care for Children. If you listened to the episode last week, you will have heard Diana and her colleague Alec talk about state health issues. And today we're coming back again to talk about federal issues. Diana, how are you feeling today?
I am okay. I'm ready for Christmas break.
I am too. I think all of our listeners hopefully are too. Take a few weeks or a week or two of downtime, a few days of downtime, and then jump back in for the legislature that's convening. But you know as well as I and most of our listeners that when we talk about healthcare, there's a lot that happens at the state level, but a good chunk of that is tied up in what happens at the federal level. And there are some really big developments. There are some really big opportunities and challenges over the course of the next year. But I know the budget process is kind of front of mind for those in the healthcare space. So if you could just start us off by talking about the budget process and how healthcare ties into that.
Yeah. So we have an opportunity before us with this incoming administration. They have made it really clear. If you read Project 2025, one of the priorities in there is tax cuts. They've all talked a lot about tax cuts. That's going to be one of the big things that they want to pass in the budget reconciliation bill first thing after the inauguration. But before the inauguration happens, so early January, the Congress, they have to set out the budget resolution, which is essentially instructions to Congress on what they can consider in the reconciliation bill itself. And so it's like it gives the framework. And if there's something in there, they have to include it. And so their aim right now is to pass the budget resolution before Inauguration Day. like right after Congress gets sworn in at the beginning of January. And so the fear right now is that that resolution will include a big number for Medicaid cuts, because if there's a big number, it's kind of like the Medicaid cuts are already baked in and Congress can't make that decision themselves because it's in the instructions. They have to put it in the bill. And so that is our national partners are really trying to get everyone mobilized right now to not wait and contact your congressman today before the end of the year to really explain and just emphasize that, Medicaid cuts are not something that we're okay with. It's going to have a huge effect on families across the nation. And we don't want to see that in the budget resolution. So keep Medicaid cuts out of there.
So the homework, like very clearly, is call your member of Congress and say no Medicaid cuts in.
Exactly. Yeah. And call them, see if you have organizations you're a part of that can also call them and say, or send letters and emails. Yes. But it's keep Medicaid out of the reconciliation bill.
Keep Medicaid cuts out of the reconciliation bill. Right? Mm-hmm. Okay. I'd love to keep Medicaid in the reconciliation bill.
Yes, sorry.
So talk to us about what kind of impact that would have.
Yeah.
If there were significant cuts to Medicaid, how would that look like?
Because, assuming worst case scenario, they get some Medicaid cuts in that budget reconciliation bill itself. And, all of the messaging around this is just going to be like, it's just a tax. We're just trying to get tax cuts through real quick at the beginning of the year. This is a campaign promise. They're not going to talk about it from the lens of we're pulling all the money from Medicaid, but that's the plan right now. And so that can look a variety of ways. They could pass a cap for Medicaid. They could put a block. They can make it into block grants, which essentially means the state just gets this set amount no matter what. Doesn't matter if your, population increases. It doesn't matter if there's a natural disaster, et cetera. Like that's the amount you get regardless going forward. And then it could also look like they could change the match rate that the federal government does with states. So like right now it's mostly a 50-50 match, depending on the program. Sometimes it's a little bit more 60-40. But so the federal government is paying a portion of that and the state is paying a portion of that. And it's a huge source of our budget in the state of Texas. It's like the biggest component is our federal match rate in Medicaid. And so if they change that percentage, it would have huge effects on our state budget and what we would be able to do as far as providing health insurance for low-income families. And then if they can't get any of those, it could just look like stricter limits around who can be in Medicaid, how long they can be in Medicaid. They might try to do like lifetime caps, like you can only be on Medicaid 1 year or whatever. So it could look a variety of different ways, but really the mindset behind all of this is, well, there's a lot of pent up appetite at the federal level for Medicaid cuts, and because it is such a big budget item. And also there's just this mindset of like the government shouldn't be in the business of providing these services to people, which, we can argue here or there about, but I think ultimately, who suffers? It's going to be poor people. It's going to be people that don't have any other options. And it means they're just going to be going without. And we know from lots of data and lots of statistics that when people don't have access to regular health care, they wait till things are an emergency. And you know what? Then it costs a lot more and it's a lot harder to get better. And we're going to end up paying that regardless as a state. So I think that's ultimately, we can't keep people from getting sick. It's just a part of life that's going to happen. Car accidents happen, right? Like injuries happen. It's just how we provide these services and allow people to access healthcare. We could do it in a way that we know is more financially viable, or we can, just have crisis care, which we know is more expensive.
Well, to be clear, when we're talking about Medicaid in Texas, we're talking about kids, right?
Yeah, that's right. So Texas has some of the strictest eligibility criteria in the nation. We really only cover kids, kids with disabilities. We cover women while they're pregnant if they're below the poverty line for that pregnancy. And then there's a few adults with disabilities, but it's 80% kids. That's who's on Medicaid in Texas.
And so this isn't to excuse the action that everybody needs to take over the course of the next few weeks, because you've mentioned that January timeline is important. That said, there might be two bites at this apple, right? If the instructions come out in January, we'll have another chance during the reconciliation process.
Yeah, absolutely. So like the main goal is to keep Medicaid out of the instructions in the budget resolution. That's the best chance we have. If we fail at that, then the goal is to bring down the bill in either the House or the Senate. That's harder for House Republicans to vote no on a tax bill because that's Trump's top priority. But the margins are really thin right now. And there's like 220 to 215 margin. There's 3 GOP vacancies at the beginning of the year. And so it's very possible to stop it in the House. The Senate's going to be so much harder. So it would be, best case scenario, we keep Medicaid out of the instructions in the budget resolution. But if it happens, game's not over. We still have this scenario where we could stop it in the House. It's going to be really tight.
All right. You got your homework at the top of the episode this week, friends. Make those telephone calls to your member of Congress today and encourage your friends to do the same. We've talked about Medicaid. There are a lot of other issues that impact children, impact families at the federal level that pass on down here to the state. Any others that you're particularly watching right now?
I think that's a big one. It's like, we've had a Trump presidency before. And so we learned a lot through that process, and they learned a lot through that process too. I would say the one thing that is probably different this time around is that they are really prepared and they know what not to do from last time. And so they have their priorities and they have their plans on how to implement them, and they're going to move really fast. And so I know it's really sad and depressing to think about sometimes. But I've just been encouraging people, like, we don't have to accept this. Like, we can fight it and make known what, people want. And this is our chance. So don't give up. Like, we can't give up yet.
I know one of the issues that we've had people ask us specifically about is Head Start and potential cuts to that and the impact it would have on Texas. So any information on that front?
Yeah, I think we at Texans Care for Children are very aware of that possibility too. It is one of our largest, after school daycare providers in the state for low-income families. That would be a huge hit to Texas and to Texas families all across the state. Unfortunately, all of these programs we're talking about kind of affect kind of the same bucket of people. And so if we start cutting all of these programs, we're really going to make it hard for low-income families to survive in our state.
All right. So we will focus on this program over the course of the legislative session on what's happening in the Texas Legislature, but it is always important to keep an eye on what's happening at the federal level as well. And so I appreciate you taking some time today to give us some updates there, and we'll all certainly be keeping an eye on what happens in D.C. and try to keep you posted as best we can. But Diana, thanks again for joining us. Any closing thoughts or shameless plugs you want to leave us with today?
Yeah, I just say don't wait till January. This is your year-end homework. Contact your congressman today.
Today, and friends, you'll be sitting around the holiday table, hopefully with some friends and family soon. Go ahead and have them make a telephone call while you're sitting there. I'm not the guy who says don't talk about these things over the holiday table. Anyway, Diana, I appreciate you and hope you have a fantastic end to the year, and hopefully we'll see you a lot in the coming year as maybe some great things will happen here in Texas. But it's always good to see you, and appreciate all you do.
Yeah, same to you, Scott. Either way, we'll get together to talk about it. So thanks.
Indeed. Thanks again.
Bye.
I hope you enjoyed this week's conversation with Diana, and I hope you took notes on your homework for the next few weeks as we work to protect access to health care to kick off the new year. Speaking of the new year, we'll take a short weekly witness break over the holidays and we'll return in January. My hope is that you all find meaning this holiday season and that you're able to refresh and renew your body, mind, and spirit. We look forward to reconnecting with you in a few weeks, ready to get to work to advocate for a better Texas and to protect those who might be targets of harmful policy. If you're ready to do that work, make sure that you're signed up for all that Texas Impact has to offer. Check out texasimpact.org and click on the Action Center to find ways that you can get involved. As always, you can shoot me an email at scott@texasimpact.org. While you're there, I hope you'll take a moment to sign up to be a member of Texas Impact. Your membership supports this podcast and all of the work to engage Texans of faith to advocate for a more just and equitable Texas. So with that, I think it's time to close out this episode. So remember, the world needs Texans of faith active and engaged. So let's get to work.
Weekly Witness is hosted by Scott Atnet, engineered and produced by David Fasalo. Our executive producer is B. Moorhead. The opinions expressed on Weekly Witness are those of Texas Impact and our guests, and do not necessarily reflect the views of our sponsors. Weekly Witness is a product of Texas Impact, people of faith working for justice. Visit us online at texasimpact.org.